Hi, good afternoon. My name is Walter, and I would like to begin by acknowledging that the land on which I'm doing my presentation is the traditional and unceded territory of Coast Salish people, specifically Kwantlen, Katsi, Semiahmo, and Tuasan First Nation. This afternoon, I'm going to present to you the patient care assessment process. So, what is this? This is now part of our collective bargaining agreement, which we have just recently ratified. And I'm going to give you a brief presentation and how it's going to work and what's the principle behind this, because there are so many confusion on this. So, what's the history? Since I came here 2008, in British Columbia, there were so many tools that have been presented to the staff. Unfortunately, these tools not really help the staff support the workload issues on the floor, even when working short. No compensation, nothing has been. Employer has not been penalized, or for the staff for not able to provide help to the staff. So the interim pickup form is being implemented now provincially, and hoping that it that to inform staffing needs, whether the nurse is working short as part of the nurses bargaining agreement. So how does this work? Uh, the pickup and interim pickup working short is going to work where staffing needs are identified but not found. Nurses will be eligible for working short premium. I will explain to you later what's nursing's working short premium. So there's two principles behind this. When you're below baseline, okay, and replacement is necessary and could not be found, then working short premium applies. Or you as a professional judgment able to identify workload and determines that additional staff is necessary but could not be found, working short premium applies again. So how? So there are three questions. First question will be uh, about baseline. If you, as far as my previous slide, when you're below baseline, no additional staff, no replacement, then working short premium applies. If you are fully staffed, then you have to go to question number two, which is the number of staff able to work on the floor, able to provide the care that the patient needs, right? If it's yes, then proceed to number three. But if what is no, then you have to mitigate. You request for staff. If no staff will come, then working short premium applies. Then, of course, number three, the question number three, when it comes to skill mix, even we are fully staffed, but you have new grads, you have care aides, and everything on the floor that's some skill mix, then you are able to identify there is a workload issue, then you mitigate with the employer to add more staff, but no staff will come to help you, then working short premium applies. So what is this working short premium? This is a premium that to be paid to the staff, to paid all nurses in the unit in the same classification during working short. One classification is LPN, RN is different classification, RPN is different classification. So if you're working that day, when you're working, there's a working short, then if you are 10 or fewer nurses, you'll be paid additional $5 per hour. But if you are more than 11 nurses, that's so $3 per hour. Anyway, I know this is so fast and so quick, but I would like to provide you more detailed presentation next time. And I know you have specific question in different situation, and why is this principle and why is this not paid automatically. Well, maybe in my next session I'm going to do that. But this point of time, I really appreciate the time you have shared with me. I know you're so busy working, but at least you have 5 or 6 minutes to come to listen to my presentation, so that able to give you some ideas of the principle behind this working short premium and patient care assessment process. So again, folks, thank you for the time and good afternoon.